Right, so the last section in part 1 we left off with blood pressure. So we're going to continue on with disorders of blood flow and pressure and go some in-depth into some more topics. So first off would be orthostatic, or also known as postural hypotension. So let's pay attention here. So we have hypo, that's low, and we're talking about tension or blood pressure. In orthostatic hypotension, what happens is when somebody changes position or posture, right, their blood pressure drops, or it doesn't return itself back up to normal as quickly as it should. What happens then is that the patient's cardiac output goes down and they don't get enough blood flow to the brain. So they often have symptoms like dizziness or fainting, which is also known as syncope for the medical term. The blood pressure, you measure their blood pressure from different positions. You should start off by having the patient laying down, and then take it again when they sit up, and then take it again when they stand up. Now, if the blood pressure numbers change, specifically if they drop 20 millimeters of mercury for the top or systolic number, or by 10 for the diastolic number, then they could be diagnosed with orthostatic hypotension. Right. This is because when you stand up, usually you have about 500 to 700 milliliters of blood that pulls down to the lower body, right? And that decreases the core or central blood pressure. Healthy people have mechanisms that help to correct this as a reflex, right? But if somebody's reflexes for this are not working, then they're going to have that drop, right? Particularly vasoconstriction happens in the lower extremities, right? Heart rate goes up a little bit, and it pumps blood back up to the core. Okay. Things that can cause orthostatic hypertension would be if somebody's overall volume, like their blood volume or their fluid volume status is too low. It can be a side effect of medications. As we get older, this happens often because our baro and chemoreceptors aren't as sensitive as they used to be. If someone's on prolonged bed rest, like you think about if you've been down and out with the flu or some type of illness for a couple of days in bed or on the couch, first couple of times you try and get up when you're feeling better, you're a little woozy or get a bit of a headache. That's probably a little bit of postural hypotension going on. And also if their autonomic nervous system is not working. So if they don't have proper chemo, baroreceptors, things like that, they're not going to be able to compensate for their blood pressure change when they stand up, and they can be diagnosed as well. Next up is atherosclerosis and coronary artery disease. So when we're talking about atherosclerosis, this is when we have a thickening of the blood vessel walls because there's been plaque formed in them. Right? Usually that plaque is made up of lipids, and our lipids come from cholesterol. So we're mostly concerned about high cholesterol here because if there's too much in circulation, then it's going to get deposited in our arteries and other vasculature, and then blood can't get through it as easily as it should, and this causes ischemia to our tissues. So we get cholesterol two ways. Our liver makes it for us, as well as the diet we eat. And I'm sure you are all familiar with the kind of diet we should be eating and foods that are not so healthy for us, right? So you have two different types of cholesterol. You have HDLs and LDLs. I like to think of HDL like healthy H, right? These are high density lipoproteins. These are known as our good cholesterol. Their job is to carry cholesterol away from the arteries to the liver so that it can be gotten rid of from the body. Estrogen for women tends to help raise our HDL level. Once women go through menopause, that estrogen level naturally falls. And this is why after menopause, women are at increased risk for heart disease and cardiovascular problems. LDLs, I like to remember that there are bad cholesterol like lethal L, right? They're low density lipoproteins. They're the ones that we're concerned about will contribute to atherosclerosis. They're produced naturally in the body, right? Some people have a genetic predisposition to make more than they should. They can also be elevated if people eat a diet too high in saturated fats, trans fats, or other cholesterols. Lifestyle changes can help reduce this cholesterol level, and sometimes people will need medications as well. The medications target the HDL level. So atherosclerosis is the condition whenever we have this cholesterol buildup, right? It makes the artery wall thicker as well as more stiff. And you can see how the size of the lumen inside the vessel is now smaller, so it's harder for blood to get through. Whenever we have atherosclerosis, it can also lead to other problems like acute pancreatitis or xanthomia. This is where the fats actually deposit in the skin. If you want to read more about cholesterol recommendations from the American Heart Association, you can click on that link in the PowerPoint. So atherosclerosis literally means hardening of arteries. It's when there's that plaque that is forming fibrous fatty lesions on the inside or intimal lining of the arteries. There's 3 different types of lesions. There's a fatty streak, where it's just a streak or a thin, flat lesion that is inside it, and it can progressively get larger. There's fibrous plaques. There's different types of those. They're the most basic type of atherosclerotic plaque. They're from an accumulation of lipids that start by getting stuck to the smooth muscle of the blood vessels in the wall, sometimes because there's a little scar tissue there, and then they just keep piling on top of each other, kind of like they clump together. Right? As the lesion increases in size, it can occlude or block off part of the vessel. It can also break off and cause a thrombus. All of these, the problem is that they reduce blood flow. So whatever tissue, organ, or whatever was supposed to get that blood is now not getting as much. A complicated lesion is whenever we have one of the other types and then it's caused a problem, like a hemorrhage, an ulceration to the vessel, or scar tissue. These are just more images of how the plaque can form. Alright, so we start off with our healthy artery. You have your cholesterol particles floating around in our circulation. We have a little bit of scar tissue there in the artery. A plaque sticks to it. More plaque sticks to it. We end up with a lesion blocking part of the lumen. So we care most because atherosclerosis is usually a precursor for other problems. Like if you have them in your coronary arteries, the blood vessels that supply blood flow to the heart, you're at serious risk of having a heart attack. Right, if it gets into your blood vessels that supply your brain, then you can have a stroke. Right. According to the American Heart Association, atherosclerosis actually starts when we're younger, and they're trying to do more with recognizing it in adolescents and kids so that we can prevent complications later in life. If we can help by changing eating habits, lifestyle changes whenever children are younger, then they should carry over into their heart health later. So they're actually checking cholesterol levels in children. And for children who are 2 to 19 years old, their total cholesterol should be less than 170, and their bad or LDL cholesterol should be less than 110. Now for adults, it's a little different. Right, we want total cholesterol to be less than 200. If it's above that, then they're at increased risk for a heart attack or stroke. Triglycerides should be less than 150. HDL, we want it above 60. All right. Men, we want it above 40. Women, for men, if it's less than 40, and for women, if it's less than 50, then they're considered at high risk for cardiovascular disease. In LDL, we want to keep it below 100. All right, if it's greater than 100, then they're at increased risk for atherosclerosis and coronary artery disease. So risk factors for atherosclerosis: as we get older, we're at increased risk. Women, especially after they go through menopause and their estrogen levels drop. If we have a family history, especially for men, if they have hyperlipidemia or hypercholesteremia, meaning that on their lab work they have high triglycerides or high cholesterol. Hypertension and smoking and diabetes are also risk factors because they tend to leave scarred spots within the blood vessels where those plaque formations start to build up. If they have a sedentary lifestyle, or if patients are obese, because this usually relates to their diet and they're not getting enough exercise to increase their healthy cholesterol levels or to utilize the fats that they take in. To manage cholesterol levels, patients very well may be asymptomatic. It's not usually something that patients feel is going on with them. So we tend to have to find it in lab work. Right, and then we have to educate them as to why it's important to treat it, even though they may not feel like they need to. Right, we are concerned because it's our number one cause of cardiovascular disease, and cardiovascular disease is always our number one cause of death in the U.S. We can start by managing lifestyle, changing their diet, having them exercise, smoking cessation programs. We can also recommend cholesterol-lowering medications like statin, cholesterol absorption inhibitors, fibrates, or niacin. Coronary artery disease now is whenever that atherosclerosis is impacting the blood vessels that supply blood directly to the heart or the coronary arteries. Heart disease is because the section of the heart is not getting enough blood flow. Most of the time it's because there's atherosclerosis in it. It can progress slowly. What happens is it causes ischemia or decreased blood flow to the tissues that then triggers chest pain, also known as angina, can lead to a heart attack, myocardial infarction. This can damage heart muscle and cause heart failure and even lead to death. Right, so there's different pathogenesis that happen with coronary artery disease. So there's stable and fixed. This is where it's obstructing blood flow, but it's not causing severe problems. They may have intermittent chest pain, considered to be stable angina. There can also be unstable or vulnerable coronary artery disease. This is where the plaque formation is at risk of causing a rupture to the blood vessel. It can also cause a clot formation because platelets and platelets have adhered to it, or it can be a thrombus where they can break off and travel. These are most commonly associated with unstable angina, which leads to a heart attack or MI. So chronic ischemic heart disease or disorders in blood flow from the atherosclerotic plaques being there. These are termed stable angina, a silent MI because they may be having damage to their cardiac muscle even though they're not having chest pain. There's also vasospastic or Prinzmann angina. There's also acute coronary syndrome. So acute means it comes on suddenly, where there's an acute ischemic heart disease problem where blood flow is suddenly cut off because the coronary artery blood supply is no longer flowing to the heart muscle. This is also known as unstable angina and is what causes a heart attack. So with stable angina, the chest pain or pressure comes and goes, meaning that it's transient. Usually it's precipitated by increased workload. So they've done something to increase the demand in their heart, like exercise, physical exertion, stress, things like that. They often complain that the pain in their chest is squeezing or suffocating. It's substernal, so below the sternum or the breastbone area. It can radiate to the left shoulder or jaw, or left shoulder arm and into the jaw. Now, the thing with stable angina to remember is that if they rest or take nitroglycerin, they're going to have improvement in their chest pain. Prinzmann angina is also vasospastic. It happens whenever the blood vessel itself has a spasm and then pinches itself off, right? Usually it occurs during rest. Oftentimes it's at night after midnight and before 8 a.m. It causes arrhythmias with its attack, and patients are at increased risk for sudden death if it doesn't resolve and relax soon enough. Next up, we'll pick up with coronary or acute coronary syndrome.